San?
Yeah.
How to scan in the phone?
I sent the link. Check the group. I sent the link.
Okay.
Let's sit down. Yeah. Shall we start filling it?
And here's the live stream for anyone who's gonna watch. Is everyone okay now? If there's some who's Maliha, is it still empty?
No, it's okay. I haven't. You can see. I haven't.
Okay, got it. So we're gonna start now. I'm gonna yeah.
Co-host, I can't enter the rooms.
Huh?
Make me co-host.
I'm sorry.
Co-host, you had to give me co-host.
Yes, Sangha, sorry.
San?
Yeah.
Bro, I have only one device.
Just use it. Don't worry about the Zoom. Just use it. Let's go into the breakout rooms.
Okay.
Okay, I'm going to open the rooms now. Go to your correct rooms. Okay.
Okay, bro. Thank you.
No problem.
Shan, you sent me the invite for room 1. I have been assigned room 5.
Yeah, just go to the correct one. It has become automatic. I didn't select anyone. It has become automatic.
It's showing only room to yeah.
Okay, it's fine. Just go to the room which was assigned to you.
I'm only getting the option for room 1 in the
Yeah,
breakout
the
room.
It's okay,
assigned
it's okay.
room is not coming.
It's okay.
Not
Go to
giving the
the
option.
yeah. It's okay. Go.
We cannot select the room.
It's okay. Go to the room which I am assigning right now. Whatever room that you're supposed to go, just go there.
So in the form, we'll fill that room, right?
Yes.
Right, sorry, Sean, in the form, so I've been allocated room 1. So should I fill up room 1 in the form?
Yes.
Or
Yes. Whatever room you are right
the Zoom call?
in. Yeah.
All right. Okay.
Okay.
Sean?
Yeah.
Sean, can you add me in the room 3?
Who's?
Sorry, I'm in team 2, room 2.
If you're a participant, whatever room you get, go to that. Okay.
No, I was just getting the invitation of room 4, and when I joined, I actually entered in the room 4.
What's your name?
What is happening with
Abbas.
Room 2.
Yeah. Can you add me in room 2?
Okay, done.
Yeah.
Sean, can you add me in room 5? Vibhuti.
I can't find. What room are you in right now?
I am right now in room 4, but can you add me in room 5?
San?
Yeah.
Can you add me room 4?
Wait, give me a second. Ian, stay in the room. I'm adding all the invigilators into a room.
Sean, I haven't been assigned a room yet.
Yeah, go to room 5.
But there's already Shanali and Sasanga in room 5.
I moved Sasanga out.
He's
okay. Go to room 2. Oh wait, go to room 3.
You have to assign me.
Yeah, I will. Okay, is everyone in their rooms?
Check the messages.
Admin room 1.
Why haven't you guys? I'm just gonna randomly add people who are not in rooms, okay? Because wait, Tushar, where are you? Which room are you assigned?
Room 1.
Should I just join the room I've been assigned to, or?
Yeah.
Okay. All right. So I'll start, right?
Yes. Wait. There's still some people to go. I will send a message.
Yeah, fine.
Okay.
Shan, not room 2. Room 1.
It didn't give me the option. Wait, Tushar, what room are you in now?
I am not in any room, but I have room 1 was assigned to me.
Room 1. Okay.
Yeah, got it. Thank
Shan,
you.
please
No problem.
assign
Yeah?
me room 3rd.
Yeah.
Room 3.
Wait. Okay, quickly go into the rooms. I sent you. Okay.
Didn't get one.
I sent. Why is it not coming?
No.
I just added you to a room. Just go. It shows that I sent you the room. Everyone has been sent.
Sean, can you please add me to room 1?
Sent. Check. You have to go to breakout rooms. Okay, you have to go to the option breakout rooms and go to the room.
It's room 2 for me only. I have been assigned to room 3rd.
It's okay. Just go to the room.
Should I join the breakout room 3 because that's the only option shown?
Yeah.
Okay.
Kamadi. Hello. I'm also gonna join a room.
Yeah, I'm gonna go. Miroshi is okay with
Yeah.
everything. Okay.
Awesome. The first round is an individual round where the students will be in different rooms. They will get different questions so as to avoid people cheating. They're answering the questions right now. 15 questions, 20 seconds each. For this round, because of the breakout room situation, we are not able to show the participants. Down here, quickly go. Actually, stay here and do this. Down here, I'll do it here. Select room 1. Yeah. Now, Nihal, I'm going to take you back to the first question up to 6. Quickly answer those also.
All right, okay.
Right.
Do I submit it now? Yeah, Sean, do I submit it now? The Google form?
Actually, our 2 questions were left and the breakout room closed early. The room 2.
Yeah.
14th and 15th were remaining.
Yes, 14 and 15 remaining.
Yeah.
Yes.
Shan, I have a doubt. Is anyone able to hear me?
Yeah.
So he sent a message saying that selecting the correct room you join in the end is good enough. The form that the QR that he sent in the group, I selected that way long before I joined the group, and I was assigned to another one. So that's okay, right?
Sean?
Did you understand me?
Sean, you are muted. Sean, you're muted.
Yeah, those who missed the last 2 questions, check that. So Deepthi, don't worry about it.
All right. Thanks.
Like, Okay, and we are done. We're going to go to the next round now. Submit the forms. So this one, group 1, you stay in the main room, okay? Because this will be broadcast to, it's on YouTube. So whatever you say, whatever you do, it will be on YouTube. The other groups also, I'm going to make 4 group breakout rooms now. Okay. Okay. Group 2. Let's go into the second round, and we have to do it fast because it took too long. So round 2, these are cases, basically medical cases from those 2 topics, hematology and endocrinology. For the single best choice, each correct response gets 1 mark. For the MCQ, if you get all correct, you get 1 mark. Okay. And remember this, one student in the team must scan the QR code and input the answer on behalf of the team. Basically, you need to go scan the QR code, do the same thing. And there should be another student in each team who is going to send the answer in the group. Okay. One person inputs it in the Google form. Another person, once you finish discussing the answers, you must send it in the group also. That's why the invigilators were assigned to each group. Okay. So let's go into the breakout rooms now. Here's the QR code.
Shan, send the link for that as well.
Yeah. Go to the correct rooms. This time I put it in such a way that you can go to whatever room you want.
Shan, breakout rooms so the groups can discuss among themselves.
They can unmute, they can discuss. Okay, you guys can discuss any way you want and come to the final answer.
All right. Yeah. Cool.
Same as last year. Quickly go to the rooms. We're going to start in 1 minute, so quickly go to your rooms.
Can you please send the QR code again, please?
Just one person has to scan it, not the whole team. I sent it in the group. Okay. I sent it to the group. Quickly go to your rooms.
The person who has to send the answers on the group has to send it question-wise or at last?
It's question-wise, because you won't get a chance to send it at last. You don't need to put question number 1, this is the answer. Just send the answer.
Okay, A, B, C, D, like that.
Yeah, same as last year.
Okay.
Sam?
Yeah? Which room?
I'm not getting the breakout room. Got it.
There should be a button which says breakout room. Just select that.
Yeah, I got it.
Yeah. Guys, quickly go because we need to start. There's still around 7 people who are not supposed to be in this room. Who's the leader of this group?
Nisha.
Nisha. Okay. Tell me the people who are not supposed to be here quickly.
Abhinav Kunjan.
Hmm?
Abhinav Kunjan Jyotika.
No, who's not supposed to be in this room?
They're not supposed to be.
Abhinav.
Am I audible?
Abhinav, which room?
Bino is in our group.
Where?
No. Vaishnavi is not in our room. Vivan Trivedi is not in our room. Maliha and Kinnauri is not in ours. Gunjan Yadav is not in ours. Mohit, yes. Sakriti. Jyotika Sharma is not in ours. Satyam is not in ours.
Join the groups and Anisha, tell me who's absent here. So Akansha,
can't join my room.
you're here. So
I can't join my room.
I'm here.
Who can't? Who
Anushka
can't?
is not here.
Hi.
Who cannot join the room? Huh?
Vivan, group 4.
Ritu.
Vasik Bhaiya is not supposed to be here.
I'm not getting your name here.
From my team, Anushka is not here.
Go to Saini. Go to the options and find breakout room. You'll be able to join. Okay.
I tried, but I can't join group 4.
Your name is not shown to me. Why is that not shown? Okay, got it.
Shan, can you please add me to group 4?
Who?
Gunjan.
And Vaishnavi also is not in our group. Vaishnavi.
Vaishnavi, which group?
Which team? Which team are you? Nothing else.
Okay.
Okay.
Vivan Trivedi is he in our group? No, right?
Yes, I am in group 4, but I am not able to join.
Vivan is going to answer for us.
Yeah, Vivan, you can do it.
Thank you.
So in exactly 1 minute, we are going to start. Okay. At 6:40, we're going to start. Anyone
Can you
who's
please add me in group 4?
who?
Vivan Trivedi.
Vivan Trivedi.
Okay, group 4. Okay, done.
Okay, thank you.
And we're going to start now. Get ready. You guys can discuss any way you want. One person.
Guys, unmute.
Yeah, unmute. Okay. I'm gonna mute myself. You guys unmute.
Okay.
You guys say whatever you want. One person sends the answer in the group. The other person fills it in the
Google Form. Got it.
All the best, guys.
All the best, guys.
All the best.
All the best to everyone.
There's cachexia, which can be malignant.
Malignancy or autoimmune?
Yeah,
Autoimmune.
Autoimmune.
Autoimmune. Yeah, because there's no lymphoid, so
Yeah.
probably autoimmune.
Autoimmune.
Okay, so we're going with A.
A.
Yeah.
Yes.
guys. Send the answer in the chat. Okay.
Read in your mind.
Hormone palpation. Is it as an injection scarring?
Yeah, I'm thinking of
Because that will be firm on our patient.
Okay, is it A? Which one?
Go with C.
Smooth
Smooth
C.
C. C? Okay. Okay, C sent.
I'm calling using Twitter with the
Okay, read the little one.
Last week.
Just read it in your mind.
The word there is compliant with these medications. There's an issue there.
Low blood pressure.
Right.
Brief.
Nisha, we have no idea.
I think it's C.
Yeah, I also
Okay, go
think
with
so.
C.
Okay. C sent.
Is unsure of.
Is it A?
A.
Could be A. Yeah.
I think A.
Okay. Anything else to discuss, or should I send the answer?
No, it's A.
No. Shilpa, you're not audible.
I think I also think it's A. Okay, A sent.
Okay. What value related to the cheap vaccine problems hypercalcemic vaccine.
Hypokalemic. So
B or C?
Primary. We don't know.
B. Primary hyperaldosteronism.
Could be
B?
primary, could be familial.
it's hypokalemic as well, na? So it should be primary, I think. B?
Go with B.
Nisha.
We go with B.
D?
D.
B. D for dog, right?
B.
B for boy.
Next D for boy. Okay. B for boy.
What happened here?
Calcium is low.
I think C.
Go for C.
C.
Yeah, C. It's C.
It's C.
20 seconds left.
Yes, C. You're going with C, right?
Yeah.
Yes.
10 seconds. What has happened?
24 years old female with a history of vascular sensitivity thyroid, which of the following would most appropriate for skin management.
Propranolol.
Is it metronidazole?
Go with E, I guess.
C.
It's A. Yeah, A.
A.
Okay.
Okay.
Which is it? Guys,
You're not audible.
guys, what are we going with?
We can go with E.
A, amlodipine?
E.
Ramipril.
Yeah, I think so.
Okay.
Looks like E.
E.
Temperature normal. Nitrate. BP low. Glucose.
Is it B?
Gluconeogenesis.
Yeah.
Gluconeogenesis.
Yeah. Nisha, just tally your answers with this.
Full boys clinically obese and shortest and B. B.
Okay. Okay.
Yeah, B. It's B.
Guys, give me a second.
Isn't it Cushing syndrome?
Yeah, no, I think it's A.
It's A. It's A. I think Cushing syndrome.
It's A. We're going with A.
Like purple stripe on.
Yeah, that's what I thought. So it's A, right?
Yeah, it's.
I think so. It's A.
Go with A.
A.
Ashwin, what do you think? It's
A.
A, right?
Purple stripe would be A.
Yeah.
Yeah.
C.
C, right?
Vitamin B12.
B12 deficiency.
C.
Yeah.
Yeah.
Hemoglobin. Can made a chart.
Wait, send the answer.
Time was over for the last question.
No, it wasn't. I ended it.
I think
you sent
it might be iron deficiency anemia.
Cushing's, right?
No, that was diet related, so should be B12.
I think B. Wait. We are
It should be
discussing this.
vitamin B12, I think.
Okay, we are discussing this. Time is going. 13th for 13th, I think it's B.
I think B.
Okay.
Disease.
Yeah,
It's
it could
B.
be B. Okay, I'm sending B, okay? Yeah.
B, right?
13B. Okay, you sent it.
All the polyocysts except hypertension and limited blood glucose.
Is hair loss?
Hair loss.
Hello.
Either it's neither
Neither
or
of
above, right? Neither of
Yes.
above or hair loss. I'm not sure.
I haven't read hair loss anywhere.
Yeah.
Okay. Then we can go with
Do
B.
it
I
hair
feel
loss
like
then.
Because there is a hump. There is a hump.
Yeah,
yeah,
hump
there is a hump
there.
and even the blood glucose is true.
Uh-huh.
Yeah, A, B, C
T is
are
true.
there, but what
Yeah.
about D?
I feel like I've seen a picture somewhere where there's a bald person. So
I think there.
it is a
I think there is.
Cushing syndrome, I
Hump
think.
is there.
Go with
Fatty
E.
hump is there.
Go with E. Go with E. Go with E. There is hair loss
No,
due to
no.
cortisol.
A hump is there. I think we should go with
A
D.
hump is there. I think we should go with D. Hair
D.
loss.
we go with E.
Hair loss is
Go
there.
with
Hair
D.
loss
This is a
is E.
symptom of Cushing syndrome.
Guys,
Okay,
quickly,
we're going
answer,
with
answer, answer.
D. D. I
Go with
sent
D.
D.
Nisha, finalize. Nisha, finalize
I
quickly.
sent it's
E.
hair loss. D.
I sent
Nisha,
D.
E. I think it's E.
I sent D.
E.
D for
E.
dog.
There is
Okay,
hair loss
next
due
question.
to
Done.
E for
cortisol.
elephant. E for
E for
elephant.
elephant.
E for elephant.
There is hair loss due to cortisol.
Yes.
MCQ questions. You have to select multiple choices. Select all the true choices. Okay.
Lead poisoning, yes or no?
B, E.
C.
D will not be there. D will not be there.
So B, C, and E, I think.
From my side, C.
What about A? What about A?
I don't remember what.
B and C are B and E are there.
Yeah.
But what about A?
Yeah, A should be there. Yeah, A is there. Sideroblastic anemia is there.
And A, B, and E.
No, C is also there.
C is
Thalassemia is
also
also
there.
there.
Yeah.
C.
Okay, then
A, B, C, E.
A, B, C, D.
A, B, C.
E.
Okay, A, B, C, E.
A, B, C, E.
Critical macro. Lead poisoning.
A will be there.
B.
A.
Producing is
A,
pregnancy.
B.
A, B.
D.
I think D is also there. I don't know.
No, shouldn't be D.
B.
A and B.
A and
A
B
and
should
B.
be
I
there.
think
B.
Only A and B, right?
Yeah.
You see,
Yeah,
I
let's
think
go with that.
I think A, B, and E.
Is
No,
not.
E is not there.
It's not
E,
there.
I'm
It's
sure.
not there.
No
You have
milk
10,
in Sheehan's syndrome, if I'm not mistaken.
you have 10 seconds.
We'll just go with A and B.
8,
Okay.
A,
7,
I'm sending A and B, okay?
5,
and
4, 3, 2, 1.
Prolonged
A is there, I think.
A is there.
A,
Hemophilia.
C.
C.
A and C.
Yes.
A and C only.
This is what is VW?
It's
Von Willebrand's factor
Disease.
or Von Willebrand's disease. Yeah.
Mm-hmm.
Okay, A and C only, right?
Wait, C is factor 8. Factor 8 is involved in intrinsic pathway. Intrinsic is APTT. This is PT.
And just go with A. No,
Just
it's
A?
multiple choice.
Malabsorption.
Quick.
A will be there.
A, next. Only A?
A.
A and D. A and D. A and D. D for dog.
Okay.
In the last question, Sahin syndrome, something was the correct answer, I guess.
No, Shyam, okay, let's do this. It's just acromegaly. Okay, so we have to send for true, right?
Yes.
Oh, is it like
Yeah,
true?
yeah, always true,
false,
always
false?
true.
Just send the true options.
Yeah, always
Okay,
true.
okay.
Osteoporosis.
Increased renal. Acromegaly.
Wait, there'll be E.
There's
Yeah, E is there.
C is there.
C is there.
C.
Osteoporosis.
Renal mass.
Can we speak like dog, box?
I think
like
B
that?
is also there.
It's confusing.
Will we have osteoporosis?
No,
Yeah.
osteoporosis is not there.
No.
So
Wait,
we'll go with
there'll be thickening of the bones.
Thickening of bones.
Maybe osteoporosis. It
In
is secondary cause of osteoporosis.
Osteoporosis
is not there.
decrease the
thickening.
density of bone, right?
Yeah.
But in acromegaly, there is a like
peripheral neuropathy.
enlargement of the
You have
particular
15 seconds.
A
I
is
think
not
it's B, C, and E. Okay.
Okay.
B, C, and E. Okay, C is not there.
Goiter and cardiomegaly.
Is there?
Maybe there's impaired glucose.
We'll have D, I guess.
D. D is there.
If there's D, then I don't think. Decrease sebum.
We won't have C.
We won't
No,
have
C won't, we won't have.
C we won't have.
C and E.
I think E would be no E.
Sebum secretion is increases. E is not there.
E won't be there.
Yeah.
We'll have
A also won't be there.
B and D. B and D, right?
Okay,
is
go
there.
with B and D then.
Okay.
Normal formation of blood.
Okay, A is wrong.
A is false.
Yes, B is true.
Yeah.
B is true.
Yes, C is also true.
C is
I think.
true.
B, C, and E.
E is
D
true.
is D is true. E is false.
False. E is false.
E is false.
B is true and C is true.
True.
D is
Yeah.
B, C, and D.
D.
B, C, D.
B, C, D.
D is also there, right?
B, C, D. D. D for dog is right.
Yeah. Okay, B, C, D, all three.
B, C, D. Yeah.
Getting more questions?
Okay, the
Okay.
questions are finished, right?
Yeah. So
Okay, so just give me a minute to confirm with Nisha that we filled in the same answers. Is
Yeah.
that okay? Okay,
yeah, but
1A.
Wait, let me.
1A. Nisha, are you listening?
Yes, 1A, 2C, 3C, 4A, 5B,
6C,
yeah,
7E,
8A,
yeah, 8A, 9E, 10B,
9E.
yeah, 9E, E
Okay,
for ear, 10B,
okay,
11A,
okay,
12C,
okay,
13B,
okay,
14E,
okay,
15ABCE,
yeah,
16AB, B for boy,
yeah,
17AD, D for dog,
yeah,
18BCE, B for boy,
okay,
19B and D,
okay,
20BCD.
okay.
And isn't osteoporosis occurs in acromegaly?
no.
Like a secondary cause?
Wait, are you asking me?
Wait,
Yeah, I'm asking.
Yeah, we're done with Sushi's asking me.
Can you repeat the question?
Isn't osteoporosis secondary to acromegaly?
Try to explain the pathology behind it. How does it happen?
I think I read it somewhere. I'll send you the photo from that.
No,
book.
what is your reasoning? So you're saying osteoporosis is secondary to
Maybe
acromegaly.
secondary to acromegaly. Maybe. I'm
You
not
actually-
sure.
You are actually correct.
I told you. Okay, we are good to go.
Don't worry. So I was okay. I didn't make the questions
okay.
this time. I didn't make the questions this time, but you guys did well. Like when I
Shan,
say well,
I have a question.
yeah,
For Cushing, is there any hair loss?
no.
There is no, right?
No hair loss.
That's okay. Honestly, I should have done this.
Okay, so it's bad.
I should have done
In
this.
any of the pictures for Cushing syndrome, they have hair.
Brittle hair.
No,
brittle hair.
That's how.
I
Brittle
remember
hair.
the drawing in Med 101. I remember it very well.
I remember Shan's notes.
He has thick hair. I remember Shan's
Yeah,
notes.
that's the thing. I gave you that chance, because you already said E. That's why I said Nisha, finalize the answer. I thought you would go with E.
Before all this while I was choosing E, and then Sukriti was like, "Okay, let's double check," and I'm like, "Okay, we are gonna get it."
Nisha, I told you to choose the final
I could
answer.
remember
Yeah, no,
that.
don't worry.
I was also like,
Don't worry. The thing is, okay, these questions are actually hard. If you can get about 10, 11, that's actually really good. So, did you submit the answers?
Yeah.
Okay, I should have asked that first. Yeah, if you have any other questions, you can ask, but you guys did well in general.
What was that?
maybe we could go through the questions again and discuss.
Why not?
Yeah, till the other teams are not done.
Yeah, let's.
What was that? Shahi syndrome.
Yeah. Sorry?
Sheehan syndrome.
Sheehan syndrome was not an answer.
Okay, good.
Yeah, Sheehan syndrome is like when what to say, like after postpartum. Postpartum bleeding leads to, like, if it's a lot of bleeding, then the necrosis happens in the pituitary gland. So I think all the hormone levels go down
Why is this wrong?
from the pituitary gland.
Yeah, everything goes down. The secretions basically stop, and then what happens is the wait, why do I keep going there? Structures above the hypothalamus will produce excess hormones. I'm just going to show the SBA question.
The hypothalamus produces excess hormones because there is no hormone in the blood to give the negative feedback mechanism.
Exactly.
That's why, right?
Exactly. So for this question, let's see the answer. Answer A, autoimmune.
Okay.
Correct.
Okay.
Yes, that's correct.
The answer is B. Injection
that's
scarring.
wrong.
Remember this. The moment you see smooth lump, always assume either lipoma or lipohypertrophy. But because this patient is a diabetes patient, they will have lipohypertrophy in different locations, such as around the eye, different locations.
Will that be firm on palpation or comparatively?
No, it's smooth. Yeah, in the sense when the word smooth is important here. What they mean by firm is it's not liquid. Like it's not a fluid.
That means we can feel it as a mass or something.
Yeah, you feel it as a mass.
Okay, and people who manage their diabetes very well, do they also have this this mass?
It's usually a late stage finding, especially in elderly women. Answer C. What's the question? Oh yeah, this was easy.
Yeah, this was right. You
Yeah.
did it correct.
Fourth question. Nisha, you were correct. Von Willebrand's disease. Partial thromboplastin time, what does it measure? PTT.
Intrinsic pathway.
Yeah, all factors except, okay.
The third and the seventh.
Yeah, so 7 is for PT. Let me check the answer and check the question. Oh yeah, this was
yes. This one is correct.
yeah.
This is correct. We were so confused between B and C.
How is familial? How is
Actually,
familial different from primary?
That's the thing that I need to ask the person who made the question. Why? Because I cannot. Probably the age. Like usually familial diseases occur early on, like when they're in their 20s. So whenever there's a familial disease, let's say there's anything coming from the genetics, is going to be presenting usually very early. But then I need to confirm the reason why. If the reasoning is not good enough, I will put answers B and C as correct.
Okay, I thought because it showed hypokalemic, no? So I thought maybe because of that, because otherwise potassium levels would have gone down earlier. Or it could be managed
both are hyperaldosteronism, right? So both will manifest as hypokalemia.
Yeah. Both have the same presentation. It's just the
it's just the reason. Like it can be familial, like as a genetic cause, or it can be primary, like the person develops it on his own.
That I need to double check. This one I think you got it wrong. What happened here? 20-year-old man. Okay, guys, I think the others are joining. Give me a second. I'm getting a call. This one.
Calcium is low, right? PTH.
Parathyroid.
Parathyroid levels aren't they directly proportional to calcium levels?
Vitamin D deficient. So vitamin D is needed for okay, obviously the vitamin D levels are going to be low, and you need vitamin D to bring in phosphate level. You need vitamin D to bring phosphates. Okay, and this patient has low calcium, so there's going to be high PTH. Because with high PTH, there's anyways going to be a loss of PTH. Of phosphates. Let me explain it again. Obviously, vitamin D deficiency means there's going to be low vitamin D. There's also going to be low phosphates because you need vitamin D to absorb phosphates from the gut. And with low vitamin D, both phosphates and calcium are not being absorbed into the body. So the PTH levels will be high, which in turn is going to cause the phosphate levels also to go down. That's the reasoning for that. So I'm just going through the questions till the others come.
Who is that?
Okay, answer.
This was correct.
This
right?
is methimazole, yeah. Okay. You need to hyperthyroidism, methimazole, and PTU, propylthiouracil. That's what you use to stop this. You inhibit the enzyme. And this was correct. Oh wait.
Yeah, this was you were confident. Wait. No, it's wrong.
It's wrong. Wait, let me check. A newborn female with edema, jaundice, trouble breathing. Okay, blood type of the mother is AB negative.
Father and baby are positive. It's RH hemolytic.
Yeah, it's RH.
Yes.
It's a silly mistake. Like we haven't checked the
options. We didn't even read all the options.
Wait, we did.
Somebody shouted. Oh God.
There, yeah. For this, there has to be an O somewhere. Okay. For the answer to be there.
And can you show the options for the previous question? Options for the previous question.
Hydrops vitalis is a dead baby.
Yeah. It's a yes.
This okay.
This is such a silly mistake. I mean,
let me tell you guys something.
I was thinking for the amiodarone one.
Yeah, that's when it comes to these drugs, if you see amiodarone and if it's about side effects, always go with amiodarone. If you're not sure, just go with amiodarone.
Okay. From next time.
And what is the drug that causes a blue skin?
Amiodarone. That's a. Gluconeogenesis. You guys got it correct. This patient has so glycogen synthesis will, all the others will basically reduce the blood glucose level. The only one which is going to increase the blood glucose level is gluconeogenesis. Glucose, neo is new, genesis is production, new glucose production. Question 11, answer A. Yeah, that should be obvious. The moment you see, I heard you guys discussing purple striae, answer A. 12. This one I need to check the duration because it's either B or C. You might get both correct because the duration needs to be confirmed.
Sure.
ACTH stimulation test, adrenal insufficiency. Cushing syndrome, and the answer is C.
It's okay.
Yeah.
It's okay, Nishan. It's okay.
What was the answer for 13th one?
13th, B.
Yeah. Adrenal insufficiency, right?
Yeah.
Okay.
Addison's disease. And we're going to discuss question 15. Then, okay, now that's. Okay, let's go through these also. 6 questions left. It's all except D. Wait, let me check. Yeah. All except D.
Yes. ABC.
Yeah. This one, prolactin levels increased in not. Pregnancy, it's increased. Primary hypothyroidism, bromocriptine will inhibit it. Polycystic.
Polycystic
Why in polycystic kidney will prolactin increase?
There's going to be increased. I actually can't remember, but if I'm not mistaken, I think it has something to do with high estrogen. Wait, I'm not sure actually. I'll have to check. I'm sorry, I'm not sure about that. I'll have to check that. Let me write it down. Okay, warfarin, what does it inhibit? Protein, which vitamin?
Sean, I think everyone's here.
Okay. It inhibits vitamin K. Yeah, 54 have joined. So 5 groups. Remember, warfarin therapy inhibits vitamin K. Vitamin K is needed to form 2, 7, 9, 10 factors. A is an answer. And obviously, chronic liver disease is going to be an answer.
Yeah.
Because the liver synthesizes all of these factors. Okay. Malabsorption, I assume vitamin K.
Vitamin K.
Yeah.
Yeah, we'll go ahead.
All are true.
Cases.
Yeah. Let's go to the cases now.
Okay.
Round 3. So, last round, and this time, I'm gonna give you guys a random order because this time we are gonna release the results a bit later. Okay. Let's just go 1 to no. Okay, 3, 4, 5, 2, 1. Let's go with that.
Sean, can you make me the co-host, Shanali?
Yeah. Okay, group 3. Group 3. Pick a number.
4.
4. Okay, group 4. It's a number.
2.
2. Group 5. Pick a number.
1.
1. Group 2. Pick a number.
3.
3.
Yes.
Okay. And group 1 will get 1, 2, 3, 4, 5. So go to your rooms, and this time, what is it? Group one, go to room number 5. Okay. I'm going to repeat. Group 1, go to room number 5. You guys have to stay for 10 minutes because I'll be doing your case too. Okay. Other than that, the others go back to your rooms. Group 5, stay in this room. Go back to your rooms, except for group 5, who's going to stay in this room.
Could you please add me in group 4?
Yes. Why can't? Can you check the breakout rooms? I can't add you. You are, yeah, due to some reason.
I can't join from there. I tried last time also. I can't join.
Okay, I'm gonna add you to another room. Leave that and come back, and then try.
No, still the same problem. I can't.
Okay, now we should be able to.
Okay, thank you.
Shan, what room is case 4 in?
Case 4. Wait, didn't we put the case numbers? Wait, let me check. Case 4 is Deanne.
Yeah, even she is not sure which group you are going to.
Go to. Oh yeah, group 3. Group 3.
Okay. Breakout room 3, right?
Yeah.
Shan, can you add me to group 5?
Anushka.
Group 5 is supposed to stay here, Akanksha.
Mohit.
Yes.
Which you're in group. Go to room number 5.
Okay.
Okay, so you guys get the first case. Let's. You guys ready?
Sorry, can we just check if like everyone's audible first? So that.
Yeah.
Yeah. Maliha and Siddhi, can you check your mics?
Yes.
Okay. Can you guys hear me properly?
Yes.
Okay, good.
Let's go to the case. There's a labs page also. You can request to see that page. Okay, when you want.
Okay. Oh, is there not going to be a simulated patient?
Sorry.
Is there not?
Oh
Okay,
yes,
we are
yes, yes. You can
okay,
ask.
Okay, a young girl is brought to the emergency department due to high-grade fever that started 4 hours ago. She was in daycare when she suddenly began vomiting and was found to have a fever of 39.2 degrees Celsius.
Okay.
You are interviewing the mother. Okay.
Yes. So apparently I'm the mother. Go.
All right. Okay. Hi. My name is Nonehal. I'll be your doctor today, and along with me will be my fellow doctors Maliha and Siddhi. I'm going to ask you some questions, and I hope you're comfortable with that. If at any point you're uncomfortable, please let me know.
Yeah.
All right. Okay. So, what is your main reason that you're here today?
So my daughter was in daycare, and I got a call, and they said that she started vomiting, and she has high fever, and I just took her to the hospital. and now I cannot wake her up. She seems to be unconscious, and I cannot wake her up. During when I was bringing her, she vomited 2 times in the vehicle also.
All right, that's okay. Can you just let me know how old your daughter is?
She's 4 years old.
Right. All right. So she's not been able to wake up. Have you is there anything that you've done, like called out her name, pinched her, or
Yeah, I tried
touched the
all of
eyes?
yeah, I tried all of that, but nothing worked.
Okay.
She's
All right. Has this sort of case happened before earlier with her, or is this the first time this is
no,
happening?
this is the very first time. This is the first time, and also there's a rash on her skin, which has come with the fever starting.
All right. Okay. So this is the first time. Where exactly is the rash present on the body?
It's going all over the place. I can see it in the back. I can see it on the legs, everywhere.
So all over. All right. And it started along with the fever.
Yes.
So she was febrile. And what kind of rash is it? Is there a certain shape to it, or is it completely spread out all over, diffuse?
Give me 1 second. It's spread all over, but I don't understand what you mean by diffuse.
Okay, sorry. Is it is it in a particular shape, or is it in random patterns?
No, it's red, it's black. I can see all colors.
All right, okay. Is there anything that you've done which has made the rash go away or has made her condition get better?
No, nothing. I tried work.
Right, okay. So this has never happened before. Does she have any other history of illnesses, like previous illnesses, like
No, she was a perfectly healthy child till this
no
moment.
allergies?
Nothing.
Okay, no surgical history then either. So like they
Blood
haven't any
A perfectly healthy baby till this point in time.
Okay. Have you or her father or any of her relatives had this sort of problem before?
No, no one. But then I think my son might also be developing a fever.
Sorry, how old is your son?
He's 7 years old.
Right. Okay.
And
has there been any history of any genetic problems in your family line?
Nothing like that. And I'd like, okay, now as an invigilator, okay. So I'm in this assumption you haven't yet seen the baby or anything. Okay.
Right. Yeah.
I'm going to tell you some physical examination findings, which should guide you. Okay. Now assume you are doing the physical examinations and you find that when you lift the child's head, the legs lift up.
All right. Okay.
Yeah, you can continue.
So we performed the
yes.
Okay, so we have you already performed the entire physical, or should we?
Here's the lab values.
So the WBC is high.
Sodium is normal. Potassium is slightly high.
Sodium is low, I guess.
Sodium is low. Sorry.
Yeah.
Serum glucose is on the lower side.
It's low.
Cortisol levels are low. ACTH levels are high.
Guys, you have 5 minutes to present the case. Okay. It's okay. It's okay. Take your time.
How about the WBC? Is it all right?
Sorry, Maliha, can you say that again? Your voice is not very clear.
Like the WBC value.
Yeah, it is increased. WBC value is increased.
Yeah.
Siddhi, is there anything you'd like to ask or Sorry, can I ask you what kind of diet the child is on?
Anything, you can ask me any question.
Uh,
The child eats everything that we eat. There's nothing different that she ate. So it's usually the same things such as rice, pasta, noodles.
all right.
So is that all the questions? Because I'll give you time to discuss and come up with the
Is her urine frequency and is normal?
I haven't noticed. I have not noticed. Yeah.
Like, does the child has any indigestion problem? Like when
Before
she
the
swallows.
No, this was all sudden. It happened within a few days, and temperature, she's burning up, and I don't know what to do. And it all started after I got the call from the daycare. So yeah, she didn't have any other issues before this. Okay, are you guys done? Because if you need a prompt, I can actually give you one prompt.
Yeah, go ahead. I'm not sure what else to ask. Unless we can perform the physical and there are some other physical examination
No,
findings.
the main finding is that when lifting her head, the legs move up.
The breath is the same.
Okay, I'm going to give you guys one hint. This is caused by a gram-negative bacteria.
Yeah.
Hmm?
I mean, yeah, there is high fever and then there is vomiting and rash. It all points towards the infection of some sort.
And okay,
The sun may also be febrile, right? So
yeah, check
maybe it's
the lab values. Check because there's something very important there which will tell you the diagnosis. You need to present the history because it's going over the time limit.
Wait, so do we also have to give the diagnosis?
It will be a question.
All right, okay. Low cortisol levels, what could that mean? And high ACTH levels. That means there's something that's some issue with the receptor. It's not there's not enough cortisol secretion.
Or ACTH is not acting on the cortisol receptors.
Yeah.
Exactly, it's not acting on the receptors. Maybe the 11 beta HSD is blocked, so it's not converting. But I don't know what that has to do with infection.
Check the sodium levels.
Sodium level is low and potassium is high.
Hyperkalemia.
Now also, yeah.
Which means that it is not. Aldosterone is actually working more. Aldosterone is actually working less. It's working, yeah, less. Aldosterone is also working less because sodium is less and potassium is more, right?
Guys, I'm going to give you 1 more minute. You need to present the history to me. Okay. You can discuss that part later on, but you need to present the history to me.
All right. Okay. So far, we've got a patient who's come in the.
Wait. Are you presenting the history?
No, I'm just discussing.
Okay,
I'm just letting everyone. We're on the same page, right? So a patient, a 4-year-old female child, came in with severe bouts of vomiting and high fever. The mother brought her in after the daycare called in and said that she had these symptoms. The mother was not able to wake up the patient to any sort of stimuli. There was no reaction to any stimuli. There are diffuse rashes on the skin. She is febrile, obviously. She has no history of this sort of incident previously. There is no familial history, no history of allergies. Physical examination shows, and obviously the patient's condition is not good. She is unconscious. Is there anything else I'm missing apart from the lab values?
The lab value is good.
Sorry?
The lab value is like you discussed it well. It's okay, there is nothing to
What sign is that?
Okay.
Rashes is there. She had rashes on her skin.
Yeah.
And
Rashes are all over. So
yeah. And there is son who is developing. There's also the brother of the child that's developing fever.
Yeah.
Okay. Let's go to the history right now. Till I tell you, till you are done, you need to say the word "I'm done with the history." You get to present the history.
Okay, sorry, Siddhi, what sign were you saying in the physical examination? Brudzinski, right? Yeah.
It's like it indicates the inflammation in the brain. So
Yeah,
it must
exactly.
be because of low glucose concentration in the blood.
There is some sort of infection. There is no. Is there any CSF finding?
It was not done. It was not done.
Do you prefer warm blood?
So now, Nihal, you can start presenting. Just the thing is, you don't have to worry about the diagnosis. Just present the history. Yeah.
Okay. I didn't miss anything else, right, guys? Can I start with the presentation?
Yes.
Okay. We're done.
Yeah. Okay. In the sense, when you are done presenting the history, say you are done, because then I'm going to start asking the questions. Okay. I'm going to be silent now. Okay. Yeah.
Okay. We'll start presenting the case now.
Okay.
Female child of 4-year-old comes in into the emergency department. Her mother brings her in after severe bouts of vomiting, high fever, and the mother is unable to wake her up. The child is not responding to any sort of stimuli. The mother says that there is visible rashes all over her skin, diffuse rashes. The child is febrile, and the mother says that the son may also be developing a fever. There is no significant past medical history or surgical history, no significant familial history, no history of allergies. The patient is unconscious. The lab result says that the WBC is increased at 16,000 millimeters per cube. Sodium levels are decreased, potassium levels are slightly increased, and cortisol levels are low, ACTH levels are high. Serum glucose is also on the lower side. Upon physical examination, it was noticed that the patient is positive for Brudzinski sign, where the legs are raised up when the neck is flexed. There was no other significant physical examination finding. And that's it. Yeah, we're done.
Okay. Now I'm going to start the questions. What is the diagnosis?
Based on the symptoms and the lab investigations, there is clearly some sort of infection. Since there is the patient is febrile, the son may also be febrile. So since there is Brudzinski signs, it could be a CSF infection.
Yes.
As far as what the
can you tell me in one word what the structure of the brain or whatever it is, what is affected?
Meningitis.
Okay. Give me the name. Yeah, give me the name of the disease. Like what do you call whatever?
Meningitis. Meningitis.
Okay.
Yeah.
Is it
what-
GBS? Could it be GBS?
No, it's not GBS. What is the importance of this cortisol level being low?
Cortisol levels low could be
Okay, I'm going to give you one more point. So the patient has diffuse bleeding, has diffuse rashes, right? It is red, black, and you can find it all over the skin, especially in the back and the legs. What do you think is causing that? Okay, next question. What is the name of the sign which the patient is exhibiting?
Brudzinski's kind.
Okay.
Is the diagnosis Waterhouse, Frederickson something syndrome? I'm not sure.
I'm not gonna tell if it is correct or not, but what is your final answer? Is it meningitis or is it Waterhouse Frederickson?
Let's go with meningitis. I'm more comfortable with that.
Just
Okay.
a second.
What do you think is the what do you think?
Anupaya, could you please check WhatsApp?
Huh? Sorry?
Nothing. I just asked Anupaya to check his WhatsApp.
What do you think is the organism causing this disease? Okay, leave that. Why is this patient's sodium levels low?
Because the ACTH is not acting on adrenal gland and it is decreasing aldosterone.
Yes, okay.
That is why the sodium levels are low.
Okay. Why is the glucose level low?
Cortisol is low, right?
Vomiting.
No. Vomiting does leads to it leads to something else.
Glucocorticoids will be low, right? It's not acting on adrenal glands.
Yeah, okay.
So final question, are you going to change your diagnosis or are you happy with that diagnosis? That's my final. 1 minute and I go to the next. I get the others.
Siddhi, Malia, any guys, any opinions? Angsha, I saw your photo. I'm not sure about Waterhouse Frederickson because we haven't really come across it a lot. I don't know how if a rare infection would be selected here.
Okay, so you guys are going with meningitis? Yes.
Yeah.
Okay. Done. So okay, don't worry too much about the diagnosis because when it comes to history presenting, all you have to do is present the proper history. Okay, and the diagnosis is Waterhouse Frederickson. Okay, don't worry about that. Diagnosis is not going to bring you the marks. It's going to be the history. And regarding the history, I will not comment. You guys were so close, like ACTH levels were high. That means the adrenal gland is not being stimulated. So that means all the hormones, the aldosterone, cortisol, and the androgens, they're going to be low. And when you have low cortisol, a child is at risk of Waterhouse Frederickson syndrome.
This is honestly the first time I've heard of Waterhouse Frederickson.
It's fine. Like this is not about getting the correct diagnosis. It's more about presenting the case, and you guys did well there, so it's good enough. That's it, guys. Go to the other room.
Wait, so all the rashes in the sun being febrile, is that just a throwaway? Is that not something significant?
Oh, it is, because this is caused by Neisseria meningitis.
Okay, so it is a
respiratory disease.
right, yeah.
So yeah, that's from microbiology. So that's it. Like you did the taking a history presentation well. Go to the 5th room. Okay.
All right. Thank you.
Okay. Actually, wait. We are done. We'll be releasing the marks in a few days, so you guys can leave the meeting and tally. Okay. I'm gonna take the other case, and then I'm gonna end the meeting. That's it.
If you guys just want to discuss, like,
Go ahead. That's up to you.
group
Yeah,
five.
and then you guys leave the meeting. That's fine. Okay. So
all right, I'll be in group 5. Yeah.
Yeah.
Thank you.
Okay. See you. Okay. Are you guys the other team? Are you guys ready? The case is going to be relatively hard, but the main thing is you need to present the history. You need to ask me questions, assume I'm the patient, and you need to. This is not your case. Okay. This is still the group 5's case, and let's go into the case for you guys. Case study 5. That's all the information you get. You can question me though.
Okay, so the time is started.
Yes.
Okay. Hi, good evening. I'm Sukirti, and I'll be attending to you today. So may I know your name?
My name is Sean.
Okay. Are you comfortable enough to answer the questions that I'm going to ask?
Yeah, no issues.
Okay. So what is your age?
I'm 25. No, I'm 17. Sorry.
Okay. I understand that you have a lump on the neck, which has progressively increased in size. Apart from this, would you like to mention anything else that brought you to the clinic today specifically?
No, I was having a shower when I noticed that there was a lump in my neck, and it's in the front of the neck. And so a few days ago, I didn't feel it as much, but then I can feel that it has been increasing in size.
Okay. Is it painful?
No, it's not painful.
Okay. Anything else that you would like to add on this?
Yeah, I am worried that this could be something severe. Do you think it is something severe?
We'll know in a while. For now, I don't think so. Okay. And for pain, when did it start?
I do not have any pain.
Okay.
I just came because there's a lump.
Okay. Anywhere else have you discovered a lump apart from this?
No, just here.
Okay. And any skin coloration or something?
Nothing like that. But then I have been getting these palpitations. I've been getting a sudden increase in my heart rate. There's no specific time it comes. It stays for a while and suddenly goes away. And
okay.
Yeah, right now I feel fine. Yes.
Okay. Did the lump start suddenly, or did it gradually increase in size?
So I noticed it around a week or two ago, and right now it has maybe doubled in size from what it was.
Okay.
That's why I'm worried. Do you think it's an enlarged lymph node?
It could be, or it could be something else as well. Let's see. Okay. And do you think no more swelling? Okay. Do you have a fever?
No fever, nothing.
Weight loss again?
hard to say. I might have lost around 7 kilos in the last 3 weeks, but I have been working out too. So.
Okay. Do you feel any tiredness?
No.
Loss of appetite or loss or gain?
Yeah, I assume it's because I'm working out that I'm not eating as much. But yeah, I have not been eating as well as I used to.
Okay, thank you for sharing that with me. I'm going to ask some specific questions now to help me work out what might be causing this. Okay, do you have high BP?
No, but then I have that palpitations, like I just said, it comes and goes. Yeah. Huh?
Okay. Are you diabetic?
No.
Any medical history?
Nothing.
No surgeries before this? Before?
No.
Okay. Do you suffer from any allergies? Do you have them?
No allergies.
Okay. Are you taking any medications?
No.
Okay. Do you smoke?
No.
Nausea?
Nothing. No.
Sweating?
Sorry?
Do you feel any sweating? Extra sweating or less sweating?
When I get the palpitations, I feel like I'm sweating more. I feel very hot. My head feels full and I sweat. Yes.
Okay. Do you feel any tremors? Like shaking of your limbs? Shaking?
I'm not sure. Maybe, but then I've always had a slight tremor in my hand.
Okay. And
the previous doctor said, yeah. Okay, go on.
Any medical problems that run in the family?
Would you consider my mom having had surgery when she was around my age important? She had a history of a lump in the neck which had to be removed.
Okay, thank you for telling us that. And who's at home with you?
I live with my parents.
Okay, are you currently working?
No, still high school.
Okay. And what is your diet?
I eat what everyone eats, usual stuff like pasta, salads, rice, everything.
Okay. And about the tremor that you mentioned that you've had since a young age, have you been to any doctor regarding that?
They did not say anything. It actually happened around 2 to 3 years ago, but then they were like, they did some liver tests. The liver was all fine. So that was about it. They didn't go. They said it was not important. It was not dangerous. It's just, they said it's nothing to be worried about.
Okay. Okay, guys, anyone else has to ask anything?
Have you had any history of diarrhea recently?
No.
Any ankle swelling?
Nothing.
And any kind of anxiety anytime?
Anxiety, like I said, when I get the palpitations, I become very restless. I feel anxious at that time. Also, I've been getting these small rashes on my lips. What do you think? But then I think it was just because of the heat. It comes and goes. Yeah.
Okay. Did you notice any changes in the? Did you notice any changes in the area around your toes or fingernails?
No, nothing.
Okay. Any other discoloration in your skin?
Nothing.
Entire body?
No.
Bluish, reddish?
No.
Okay. And could you mention the size of your swelling? Like how much is it? If you mention the length, we can say 1 to 2 centimeters, millimeters, something.
Swelling of what?
The lump on the neck.
You will have to check it. I don't know. It's about 1 centimeter big.
Do you have any discomfort while swallowing?
I guess so. The lump has been making me. Yeah, I think I do.
Okay. Do you feel that the mass or the swelling moves on swallowing? Like have you noticed it?
No, it does not.
Okay. Thank you for your time and your cooperation. In a while, my colleague will take over from me.
Okay. So you are done with taking the history, right? Now you can discuss for a minute or two and you can present it. And once you are done presenting, you need to say that you are done. Okay? Because that's when I start asking the questions.
Guys, what can be the possible diagnosis?
Could be Marfan syndrome.
No. Let's not talk about the diagnosis now. Let's just talk about the case presentations.
Alright.
Okay, so Shilpa?
Yeah. We are adding the lump size and the stuff. Mom's history is also important, right?
Yeah, it will be significant.
Surgical history, yeah, it's important. Okay, wait, let me just.
At the point that he has a fine tremor and there is no movement of the mass on swallowing.
Okay.
He has anxiety while palpitations and all.
Weight loss.
With loss of appetite. Increased sweating during palpitations.
Wait.
These cases, yeah. So
okay.
Go ahead. You have 1 minute and you need to present.
Okay, I think I'm going to do it now. Hi, my name is Shilpa and I'll present the case right now. Okay, Mr. Shan, 17-year-old male, has come to a hospital with no past medical history, and he says that he has this lump.
Wait. Okay.
He says that he has this lump that is progressively increasing in size, which started about 2 weeks ago, and it was about like 1 centimeter when it started, and he says it's doubled now, and it has no movement while swallowing, and it has no pain, and he just feels some discomfort while he's swallowing. Along with that, he's saying that he is tachycardic sometimes, and while tachycardia, he has this sweating and his head feels heavy. He also mentioned this slight tremor in his hand, which he has always had since like 2 years, which he went to hospital, but the doctor said it's insignificant. Also, he has this family history. His mom had the same lump on her neck, which she removed through a surgery. Also, he mentioned he has lost around 7 kgs in last 3 weeks, but he doesn't feel tired. Also, he mentioned small rashes on his lips, which comes on and off. And lots of appetite is there, but he said since he's working out, it might be because of that. And on physical examination, he seems to be a tall, thin man, but his arms are longer than his height. And for completeness, I would like to suggest more further investigations and procedures. I think we're done.
Okay, is it done?
Yeah.
Okay, I'm going to start asking questions. Okay. The first question: what is the diagnosis? I'll give you guys a minute if you want to discuss.
Okay, give us a minute. Yeah.
His length of arms is greater than height in Marfan
Looks like
syndrome.
Marfan syndrome.
Okay, does Marfan syndrome have a lump?
The palpitations and all, it looks like something hyperthyroidism because he has increased sweating and all. I don't know, maybe it makes his syndrome.
But in the case of hypothyroidism, that the movement would be there, right? But he said that there is no movement.
And also, I don't
In the
think
case
so,
of a swelling, there is
hypothyroidism because he's a decreased appetite and weight loss.
Yeah.
Yeah.
So I think we shouldn't consider the case of
But
thyroid.
weight loss could be due to exercise, right?
That
No, like
might be
7 kgs in 3 weeks. It's
3
a lot.
weeks is not.
Yeah, it's too much.
It's not possible.
not because of
It's possible due to exercise. Weight loss can be because of hyperthyroidism.
Okay.
Any kind of syndrome that has Marfan syndrome. Or
Guys,
maybe
your
we are just
diagnosis now. You need to tell me right now.
Lymphoma.
Okay. Next question. What is the significance of this patient's palpitations? Next question. What if the lump moved with swallowing and it was in the front?
Sorry, repeat, please.
If the lump was, if it moved with swallowing,
yeah,
give me a presumed diagnosis for that.
could be a cyst,
What's the
a thyroglossal cyst.
Yes.
A goiter. It's a goiter. So
It's a goiter.
goiter. So
Wait.
it's
Goiter could be the case for hyperthyroidism.
yeah.
Okay, so you guys are going with the diagnosis of hyperthyroidism. Is that correct?
No.
You need to. Now, the next question is, you guys said the mother has, when you presented the history, the mother has a same type of lump, same lump. That was what you used. Why did you say same lump?
That could be genetic.
Okay. And what is the importance of the rashes on the lip?
Okay. Maybe allergy.
Sorry?
But he has no
lymphoma have rashes on the lips, right?
Okay. I'm going to end the question session. I need a diagnosis. I'll give you guys 1 minute.
Okay.
Nisha, what diagnosis should we go in for?
Okay, guys, let's go with lymphoma.
Its skin rash is Hodgkin's lymphoma.
I think lymphoma because there are rashes.
I think it's lymphoma.
Yeah.
Yeah.
Let's go with
let's go with that.
Going for Hodgkin's lymphoma then.
Yeah.
Now, Nihal, I need you to give me a diagnosis after they give me a diagnosis. Tusha, you also. Okay. Wait.
No, we are not in
Wait.
this group.
Yeah, I know. After they are done, after they are 100% done, I need a diagnosis.
Can you?
Guys, we're going with lymphoma,
Are we going with Hodgkin's lymphoma?
We're going with lymphoma.
We are
Only
going
lymphoma.
with
Okay, that's your diagnosis. So is that the final answer? Because I need you guys to.
Yeah.
The final answer is lymphoma only, right? No Hodgkin's. Correct, Nisha?
Do you want to go for Hodgkin's lymphoma?
No,
It's
only
okay.
lymphoma.
Okay.
We're going for lymphoma.
The main thing is the main thing I want is your history presentation. And
Okay, let's go for lymphoma.
Okay, lymphoma. Okay, so I'm gonna lock in your answer. Anyone else, based on just this, or if you were listening, can anyone else suggest a diagnosis?
What's the full case? Like, is this the question? Just this?
Yeah, that's all they get. A lump which increases in size and a tall, thin man with arms longer than his height.
It looks like something related to thyroid, but I'm not sure. Because
looks like it is like a Marfan syndrome.
Could we have said like Marfan syndrome along with
syndrome? Because span longer than his heart, which looked like Marfan syndrome. Or
Yeah, but what about the lump?
Marfan syndrome
Yeah,
has a lump on the
exactly.
neck.
I'm going to help you guys. Yes, it is a Marfanoid person.
Marfan habitus. Habitus. There.
Yeah. Okay. So you guys are saying it's Marfanoid habitus. But what about the lump?
And also the rashes on the lips.
What is that suggestive of? This patient presents with a lump on the neck, has episodes of palpitation, is a tall, thin man who has arms longer than his height, and finally has rashes on the lips. The most important parts. We're going to end the meeting in a minute or two, but can anyone guess? So, okay, my cases, the diagnosis was meant to be really hard. Okay, and I wanted the history. I wanted the people to present the history properly. That's where we'll be, when we put in the final marks, the diagnosis is going to get less priority, because honestly, both of these cases were not meant to be easy. This is a multiple endocrine neoplasia.
Oh God. We were nowhere near it.
Yeah, meant to be.
Is it meant to be?
It's a main
Is
syndrome,
it meant
right?
to be?
Yes, multiple
Yeah.
endocrine neoplasia.
Is it
Meant
to
to
be?
be? Yes.
Meant to be, yes.
Yeah, I wasn't expecting any. Okay, can anyone guess the diagnosis of this? This is a young child, a young girl who was brought to the emergency due to high fever. She has neck rigidity, and there is rash, diffuse rash, and then there's going to be elevated white blood cell count, low sodium, high potassium, low glucose, low cortisol, and high ACTH levels. What do you think is the diagnosis? If you guys can answer this question, you guys are at the top of your game.
Cushing's.
Cortisol level is low. And the patient is not on any medication.
It's Edison.
Yes, you are very close to the diagnosis. What about
Of adrenal gland?
Huh?
Tumor of adrenal gland?
No. Okay, there's an infection here, obviously. Like, okay.
Like there's meningitis.
Yeah, WBCR raised, so there is obviously an infection.
Yeah. So what do you think is happening here? There's an infection, and then the high-grade fever, and then the neck rigidity. Those who are doing microbiology,
It's
you should know this.
meningitis.
Yes, it is meningitis caused by what is the disease-causing organism? Okay, I need to say it again for those who had my cases. It was not about the diagnosis. It was meant to be hard.
I'll be really impressed if the rest of you know this diagnosis.
Sorry?
I'll be really impressed if the rest of you guys know this diagnosis.
Exactly. Exactly, because this is an important topic, which is, let's see if you can get the diagnosis. We'll spend 1 minute and we'll end the meeting afterwards. The marks will be released in a day or two. Okay.
Neisseria meningitis.
This lab values is what's going to change the diagnosis. It's a child who has neck rigidity, who has meningitis, who presents with these. And the child is also unconscious, if that helps.
Bredzinski sign is positive. That helps. But it's meningitis, so it's you just figure that out early.
Anyone? Okay, we'll end it. This is called Waterhouse Frederickson syndrome. It is caused by Neisseria meningitis, and it's a complication where when the patient has low levels of adrenal hormones, it can lead to hemorrhage in the adrenal glands, bilateral hemorrhage, which is a very dangerous condition. Okay, I wasn't going for the diagnosis. I wanted you guys to present the history. So yeah, that is it. I hope the other case, I don't know about the other cases, but then I'll be lenient when I'm marking. I'll have to be. Okay, that is it for the competition. For the first round, we'll be having the second round later on. And so,
okay.
Yeah.
Shan, could you share the PPT, this PPT on the group, CMK group?
Yeah.
I will. And if you have any, if there's any, how do you say, dispute in the questions or the answers, send it through the leaders to us. Okay, the leaders, please forward those doubts because we need to finalize the marks in a day or two.
Okay.
Okay.
And for these cases that you just sent, that we did right now, just to please mention the diagnosis also in all the cases, if you can.